and thank you for coming. My name is Dr. Lucretia Greear. I'm the owner of Woodhaven Animal Hospital and the owner of a Sechrist Hyperbaric oxygen therapy chamber. We at our hospital have the 8-foot chamber, so we're able to treat multiple patients in the chamber at one time. And so I'm just want to talk to you a little bit today about Hope, and that is the name of our chamber and how she is helping advancing patient care at our hospital. Okay, who is Hope? Hope is the name of our chamber, and we named her Hope because that's what she does. She gives hopes. We treat animals and patients that come in, and it's the end of the rope for them, and they're out of options, and we're looking for things to do to help them, and Hope does that. She gives a second chance when we feel like we don't have any. So we named her Hope. Inspiration for bringing hyperbaric oxygen therapy into our practice. When my son was 3 years old, he had a near drowning incident, and we almost lost him. And then as we were looking for alternative therapies and things that we could do to help our son, oxygen heals. Oxygen heals. Oxygen has so many therapeutic, beneficial properties for so many different ailments, and there's so many indications and so many things that we can use oxygen therapy for in practice. We actually are proud to be the first hyperbaric chamber in the state of Michigan, and we've done over 2,000 treatments in our chamber this year. So we're really proud of that. All right, how does hyperbaric oxygen therapy work? It significantly increases the amount of oxygen delivered to the patient's tissue via plasma. Your red blood cells is generally what we know of as your oxygen carrying capacity. The beauty and the benefit of hyperbaric or pressurized oxygen therapy is that we don't just have what the red blood cell carrying capacity can do and supply for the body. We can actually deliver oxygen into the plasma regardless of what your red blood cells are carrying. And that can equate to 4 times more than what a normal person or a body can carry in terms of oxygen. And when you can deliver that amount of oxygen into a patient and into tissues via the plasma, these are some of the benefits that can be experienced. Enhanced or accelerated wound healing, swelling and inflammation, significant reduced swelling and inflammation, and pretty quickly. Increased oxygen delivery to the tissue, and again, because you don't need the red blood cell carrying capacity, it can diffuse directly into the plasma via the pressure that's generated in the chamber. Infection control, bacteria, bugs, viral agents, cancer, these things don't like oxygen, and oxygen kills them. They do not survive, and they don't survive in the face of oxygen, and oxygen can help to kill those things. Increasing blood vessel formation, a process called angiogenesis. It is a very complex and complicated process, but pressurized oxygen can help turn on the chemical mediators that help cause angiogenesis in the body. And if we can improve or increase blood vessel formation, we can increase oxygen delivery to those tissues and damaged areas. Tissue dies because it loses oxygen. That's generally why tissue dies. And so if we can increase blood vessel formation, that's going to allow more red blood cells to be delivered to the tissue and more oxygen to be delivered to the tissue to help heal it and prevent damage. Reduce toxins from the body. Oxygen can help reduce and eliminate toxins from the body, and stem cell activity. Oxygen therapy can increase stem cell derived growth factor and platelet derived growth factor, and stem cell activity in the bodies. Everyone has stem cell activity. We have it from birth, and when we're younger, we heal very quickly because our stem cells are so active. As we get older, they get sleepy and become dormant and aren't as active. So it takes our bodies longer to heal. By delivering hyperbaric or pressurized oxygen, you increase stem cell activity because you're actually activating and turning those cells back on, and increasing your healing ability. Some of the things that we have used hyperbaric oxygen therapy in our practice, and this isn't everything, but these are some of the things that we've treated in our patient over the 2,000 cases in the last year. The highlighted ones are probably what we do the most and see the most cases if we were to kind of divide out the most. Post-surgery, post-dental, just because the anti-inflammatory and increased healing and anti-infective properties of oxygen therapy, we pretty much have kind of made it a standard of care at our hospital that pretty much post-operative, post-surgical procedures that they'll go in the chamber to recovery at least once. Paralysis, IBD, inflammation and arthritis. We have some senior patients that come in just for oxygen therapy because it helps with pain management and inflammation we've treated a number of skin conditions, skin allergies, allergy issues, MRSA. I mean, the list is huge here, and I'm sure there's more things on here and more indications that can be found. Some of these are actually approved use in human medicine, stroke, the wound healing. Those are kind of like the biggest things. Smoke inhalation and house fire. That's pretty much carbon monoxide poisoning. The hyperbaric oxygen therapy is probably one of the only things that can help a patient suffering from carbon monoxide poisoning, near drowning. The list is extensive, and I think that it will continue to grow. I don't think that there's too many things that we won't be able to use oxygen, at least adjunctively, for in veterinary medicine. So just to kind of go through a couple of patients that we've treated in our hospital that kind of really struck and were pretty amazing. This is Gracie. Gracie presented to us. It was kind of a unique situation. The owners of this dog, they were having some renovation and work done in their house, and at some point during the night, Gracie fell down in a heat vent. She was upside down in a duct for about 12 hours. When Gracie came out, when they found her, they literally had to pull her out of the chamber. She was pretty much non-responsive, lateral recumbent, and I mean, we thought pretty much brain dead. You can see how much blood, how much her skin, if you could see it. It's hard to appreciate in the pictures. You can kind of see a little bit here, the redness in her face, but her skin, literally from the blood just rushing to her head. She had intracranial pressure, intracranial edema. She was pretty much a comatose patient and non-responsive from being upside down in a heat vent for so long. She came to us for basically a second opinion and see what we could do to help. At the time, we did not have an oxygen therapy or oxygen chamber at our facility, but we were discussing, and we were kind of in process of bringing it to our hospital. And I felt very strongly that getting Gracie in a hyperbaric chamber could save her life. And so we were able to find and locate a human facility that would allow us to bring Gracie there. And we facilitated, we were able to get her in. She was treated for about maybe 4 weeks, probably 4 weeks total with oxygen therapy. But within the first week with Gracie, this is in the first week, she went from non-responsive, lateral recumbent, pretty much comatose, to this after the first week of oxygen therapy. And today, you would never know that this happened. She is pretty much a normal dog. She doesn't have, she's a little quirky, but I think she was always quirky. But she is well loved and has a good quality of life and pretty much no long-term issues or damage or injury from that incident. So that's a miracle, because her prognosis was pretty poor when she came in. So that's Gracie, and she's a really special patient. She's a really special patient at our hospital. So next, this is a guy named Oscar. He came in, and this is a picture after we had already started to kind of clean him up and everything. But he came in with severe generalized demodicosis. He had a secondary fungal and bacterial infection. He was lame, very painful, very weak, dehydrated. Your skin is it is the largest organ, and having this much of your skin disease or affected, it took a big toll on him. We started him with oxygen therapy, and obviously we used it adjunctively. We did some other things too. We did kind of the standard protocol for demodicosis. But animals with generalized demodicosis, generally the time to recover can be 6, 8, 9 months. I mean, I've seen some cases even a year out with a severe demodicosis like this that still aren't normal without oxygen therapy. Oscar in 3 weeks, 20 sessions. The yeast, the fungus, the bacterial infection, and the demodicosis, not only is it under control, but pretty much gone after 3 weeks. We're still kind of doing some maintenance things with Oscar, but he pretty much had a really good, amazing response using the hyperbaric oxygen therapy adjunctively. All right, distemper, tick-tock and tiny. Sam should actually be talking about tick-tock and tiny. He came to us, he was a distemper virus patient. Most veterinarians haven't treated very many distemper virus cases. He was unable to walk. He had a number of issues. His quality of life was very poor. He had trouble sleeping. He was very vocal. A number of neuro symptoms. We started him pretty aggressively because there is no medical therapy really except for supportive care with distemper virus. We started him pretty aggressively with oxygen therapy, and Tito has recovered, and he ticks. He still has the myoclonus, and that's a long-term thing, and we still do maintenance hyperbaric oxygen treatments with him. But the myoclonus, the ticking, is pretty much the only symptom that he has that causes him any changes, any clinical changes for Tito. But he's a really special patient. He came to us and he was no hope. And it was either we try this or we put him to sleep. And he has a very good life with Sam, our hyperbaric technician right now. And so we get to see him and love him every day. So that's Tito. Lyric. This is a house fire patient that came to see us. The owner had gone in and came home and his house was on fire. He came home from work. His dog was inside the house and was trapped in the kitchen because he had him basically walled off in an area to try to confine him in the home while he was gone. He had just a tremendous amount of smoke inhalation damage and the skin, the burns, severe burns. When he first came in, again, another non-responsive, lateral recumbent, comatose patient. We did get a tail wag from him, and we have that on video when he first came in because we were actually unsure if it was worth trying with him. He looked that bad when he came in. But our hospital, we're about hope, and we're about that second chance and giving chances. So we tried with him, and in a 4-month period of time, and you can see the progression, and it was pretty amazing. And I've never experienced a house fire case or patient this severe ever, but his recovery was unbelievable and remarkable. And to see him today, he looks even better than this final picture here. To see him today, it's almost, you can tell he has the scars of a house fire patient, but his quality of life is really good. And he's actually living with one of our technicians now. But he made an incredible recovery. The wounds were extensive. What you can't see on the back of him is the top on the dorsal aspect. Most of his back, I'd say close to 65-70% of his skin he lost, and he had to regenerate. And I am 100% positive that the chamber saved his life. There is no way in human medicine or anything that you can do to heal the extent and the amount of damage and burn tissue that he had in the time frame that we did it. So he was an amazing success story with our hyperbaric oxygen chamber. And we got quite a bit of media attention from him and his case because he responded and did so incredibly well with our hyperbaric chamber. So that's Lyric. Another special case, this is a paralysis case. This dog came in, it was actually quadriplegic. It was paralyzed on all 4 legs and had been for about a 3, almost 4-month period of time before the owner came to see us. She had done other things, steroids, neuro consult, and what the dog had intervertebral disc disease. And pretty much she was told that there was no chance that this dog would ever be able to walk again. And so we were, again, a last hope for little Dexter here. Dexter came in and we started him. We did a lot with Dexter. We were using chiropractic, acupuncture, and the hyperbaric oxygen chamber to get him going, because this was it. And this owner was really desperate to try to get him walking again. And he's ambulatory and has an amazing quality of life and has had no symptoms or signs since we've gone through his treatment. So Dexter was able to try to start to walk after the first week of hyperbaric oxygen therapy. Just seeing him and hearing from the owner and getting updates all the time, it's amazing. So we're really proud of being able to save this little guy's life. So that's Dexter. Another demodicosis, and some of these demodex and some of these skin cases can just be so severe. This dog they found in an alley and thought was dead. They actually touched her and realized that she was still alive. She was swollen, and they thought autolyzed. Basically, they thought that she was dead and rotting when they found her. And then when they touched her and realized that she moved a little bit, someone brought her to our hospital to see if we could help her. We checked her, and I mean, the skin, the lesions on her, the swelling in her skin, she was so severe, probably one of the most severe cases of demodicosis I've ever seen. Another 20 sessions. We did basically 3 weeks, 21 days of hyperbaric oxygen therapy over 3 weeks. And the improvement with these skin cases it's unbelievable. There is no medication, and we're using medication with it, but I've never seen medical therapy do what this chamber can do adjunctively with these cases. So this isn't the most recent picture of Layla, but she looks like a normal dog, and you would hardly recognize her from that first picture. So, and again, the chamber made a huge difference for her. We see a number of skin cases and have a number of pretty amazing responses with these generalized demodicosis cases. So that's it. There's, like I said, if you our list of all the things that we have used the chamber for, the animals, I've treated squirrels, turtles, I had a snake with respiratory issues, the dogs and cats. There's so many things that we can use the oxygen therapy for. There's so many indications, and I think there's going to be even more. And I am blessed to be a part of the Sechrist family, and I am even more blessed to be able to have such an incredible modality and an incredible adjunct tool to help my patients. And I feel like it's something that we all as veterinarians, is something that we should be looking at in terms of advancing our patient care, because there's too many animals get put to sleep and lost before we've exhausted our options. And I think that if we had tools like this, if more veterinarians had tools like this to help what they are already doing and improve the prognosis for their patients, we could save a whole lot more. So hope heals, and that's my presentation on hyperbaric oxygen therapy. Thank you so much.
To find out more about Sechrist Veterinary Health full line of veterinary hyperbaric products, please visit us at www.sivethealth.com. Our team is standing by to serve you.